I'm Dr. Andrea Campian, and I'm a physical therapist currently living in San Diego, California. In this video today, I'll demonstrate a few techniques that I use in the clinic and hopefully give you some insight into my clinical approach as a therapist. Much of my treatment philosophy comes from my work with the Institute of Physical Art, founded by Greg and Vicki Johnson. This philosophy integrates scientific evidence with clinical experience and reasoning in order to treat mechanical restrictions and improve neuromuscular and motor control. This treatment approach is used to rehabilitate after injury or improve performance in activities of daily living, recreational, and professional sports.
One of the things we look at commonly in the clinic are impairments of the glenohumeral joint. If Mike here comes in with shoulder pain or a problem in his shoulder, first things I'm going to check, I'm going to look at his posture, we'll look at his functional range of motion. We'll look at things like scapular dyskinesia, different things, measurements with goniometers. And say, though, that we look at everything with Mike and we decide we're going to mobilize his glenohumeral joint. For example, adhesive capsulitis is one that we might use this frequently with. Mike, go ahead and you can lay down. Hard or limiting. So I'll just go ahead and stabilize Mike's scapula. Come in and just check, does he have a nice posterior glide, this glenohumeral joint? Let's say that I find I want to mobilize Mike's shoulder in a posterior glide. If I wanted to use the belt, I'll come in. Mike, go ahead and scoot your shoulder a little bit closer to the edge of this table. Great. And I've got the belt, the soft part of the belt, just off the AC joint on the anterior portion of the humerus. I loop my foot into the belt, get just a light amount of pressure on it. Again, stabilize his scapula. And just through the pressure through my foot, go ahead and mobilize that shoulder. Oscillations or sustained pressure, trying to glide that humerus posteriorly. I can also use my hand. And I like to use what's called a functional mobilization, similar to a mobilization with movement. We're using an isometric contraction. I'm blocking the movement that contraction would be producing, and I'm using the muscles to help facilitate a glide in that direction. So in this case of a posterior glide, I'm blocking Mike's anterior translation of this humerus, and then Mike, go ahead and gently press your elbow into the table. And then relax. And as he relaxes, I gently take up the slack, and I get a nice posterior glide. Once I've gotten that range of motion or that end feel back to a nice springy end feel, I like to follow it up with a re-education of those muscles. So Mike, you feel my fingers here on the back of your humerus. Mm-hmm. So I want you to go ahead and just hold that back there. Don't let me lift your arm bone. Good. Once I feel like I've got those muscles kicked in, I might add to the challenge. Mike, don't let me push your elbow into the table. So now we're working to re-educate the muscles, particularly of the rotator cuff, to perform that posterior glide of the humerus, while we have the muscles on the anterior aspect of the shoulder trying to perform a light isometric contraction and deflection. So we're working back into the neuromuscular re-education of that posterior glide with flexion. Now let's look at some exercises. I'm going to demonstrate a couple with Mike that you suggested, and I'll also add in a couple progressions that are my own exercises. So Mike, let's start out, we're going to do some rows. So this is an exercise that's going to help strengthen some of the muscles in your back that connect to your shoulder. It's also going to help open up some of the muscles in your chest.
Okay.
So what you're going to do is you're going to take these bands, step back so your arms are straight. And then what I want you to do is squeeze your shoulder blades back against my hand and pull the band back towards you. Good. And then bring it back forward. You're going to really squeeze those shoulder blades, making sure you keep your shoulders down away from your ears. Squeezing with the shoulder blades. You're going to keep the neck. You're doing a great job. Nice and long. Not letting the chin come forward. Mike's doing a really good job. He's got a real strong resistance band here. He's doing great. Squeeze the shoulder blades. Good.
How many times am I going to do this?
We're going to do this 20 times.
Okay.
And where do you feel this working?
I feel working right in between my shoulder blades there. That my rhomboids feel like they're getting activity.
Mike's doing his residency at the University of Utah, so he knows his anatomy. Alright, we'll go ahead and we'll let go of this. So next we're going to move on to some exercises for part of your rotator cuff and the back of your shoulder. We're going to take this towel and you're going to place it right up, this towel rolled right up under your arm. So that just puts your shoulder in a good position for those tendons. You want to make sure that when you do this at home, you get a washcloth or a little hand towel and do the same thing. Place it right up under your armpit there, all right?
Okay.
Now we're going to take this red band. You're going to face just like that. Keep your elbow down at your side. Nice and tall, face right forward. You're just going to bring your hand out to the side. Good. So you're just kind of twisting your shoulder here. Bring it right out. Very good. You're staying up nice and tall. Right there. Raise this just a little bit. We want the resistance band to be perpendicular to the action of your performing. So now let's go ahead and progress you a little bit. You're going to take the towel roll out. You're going to face the band. You're going to bring your shoulder out to 90 degrees. Step over to the side a little bit. And you're going to bring your arm up so you're pivoting right at your elbow. So your hand can be just like this. And you're going to let it come forward and back up. And what I'm looking for when I set Mike up with this exercise, ideally I'd like when he's at mid-range for that band to be perpendicular to that mid-range. So probably right about there. Length tension relationship of the muscles, this is where he's going to be the strongest. And we're watching that he's got good form. He's not arching his back, sticking his head out. That looks great, Mike.
Well, thank you.
Okay. For sports-specific training, progressions I might use, I might want to do some more stability training with Mike and his shoulder. So I might give him a challenge like a kettlebell held with the bottom up. He might just hold here, try to stabilize. He's got that perturbation training. We could even bring the elbow in, adduction, and back out. He's using those muscles of the rotator cuff to stabilize the shoulder while he's using his movement muscles to perform the activity. Good, okay. That. Another particularly for overhead throwing athletes, I might use a weighted ball, or even again the same band that we used for the external rotation exercise. And let's actually, I'll switch you out here. Let's use this. So we're going to bring you facing that direction. Back up just a little less tension. And what I want you to do, Mike, is you're going to be doing a flexing motion with your wrist as you bring it down through that pitching motion. we're watching that Mike's really working that whole shoulder. His posture is good. If he was a throwing athlete, we'd really be resisting potentially his trunk rotation, getting that full pitching motion with wrist flexion, the band resisting that entire sequence. Great job, Mike. So now let's look at gait dysfunctions. The thing I like to start out with any sort of gait dysfunction first is an isometric pushing or pulling. I feel I can really assess a person's core strategy with this activity, as well as any weaknesses, biases, hip shifting, weakness through the hips, etc. Really looking for a weight acceptance over his base of support, him finding an ability to stabilize that center of gravity over that base of support and accept the weight through his feet. So Mike, go ahead and face towards me. You're going to just stand with 1 foot forward, 1 foot back, whichever you choose. All right? And then you're going to go ahead and hold on to the handles of this dowel. And don't resist, don't push against me, but just don't let me push you back. Good, and so I just build up the pressure, and we start out with just a simple isometric, pushing and pulling, and I'm able to manually resist any compensations that I find with him to work through a really neutral pattern through here. And we can progress this, we can hook TheraBands to the end of the dowel, have him do this at home or in the clinic, or I can do it if I feel like he needs a little extra help. From here, let's go ahead and progress Mike to a walking lunge. With the way I prefer walking lunges, again, what I'm really focused on is not necessarily a vertically upright trunk. I want to see that the center of his mass, of his upper body, is being able to be balanced over his base of support. So I don't mind when he comes forward if there's a little bit of a hip hinge as his weight is transitioned over the foreleg, because he needs to have this balance of his mass over his base of support, and vice versa if he's coming back. So Mike, we're just going to do a walking lunge. You're going to keep fairly upright. What I don't want to see is you bend your back.
Okay.
But it is okay, again, as I mentioned, if you hinge from the hips just slightly. You're going to come forward, 1 foot forward, bend your knee, making sure that your knees stay in line with your second toe. Your knee's not going to come forward of your toe. You're going to do just a little bit of a squat, and then squeezing your glutes and your quads, come forward and take your next step. And I'll be here to watch you. Good. You're going to squat. I can even use a dowel or a stick as a cue. Good. Squeeze with your glutes, step forward. And forward. And we can progress that as such. We could add resistance bands, have him do it in place, add kettlebells, weights, that kind of thing. Good.